Thank you all for coming and being patient. So I'd like to introduce Naomi Perry. She is our second speaker in the 2013-2014 lecture series, and she's going to be giving a talk on the Parent-Child Interaction Therapy, A Parent's Second Hope. So we're really excited to have her here. She's at the Harborview Center for Sexual Assault and Traumatic Stress, and she is a trainer in the state of Washington for PCIT, and so we're really excited to have her here and get some of her expert knowledge on this topic. So welcome, and I'll let you do this.
Okay, good afternoon. It's been a while since I've been to School of Social Work. This is where I got my master's degree, and so I came back in, and it was like walking down memory. Can you hear me? Can you hear me now? Okay. So I'll repeat myself. I was just saying that I graduated from the University of Washington School of Social Work here, so it's kind of nice to be back. I have been at work at Harborview for like the last almost 16, 17 years, and I've been working on parenting programs, and one of the parenting programs that I have been working with has been the Parent-Child Interaction Therapy Program. And training for that came in about 2000, and we've been working with clients and families pretty steadily ever since then. So let's go ahead and get started here. Oops. So I thought I'd just walk you through a little scenario to have something in the back of your mind as we walk through this. Imagine for a moment that you have a single parent, 24-month-old, and that 24-month-old is hungry, tired, and begins to whine and is very clingy towards the parent. This child cries each time that this parent tries to do anything, like put him down on the floor or work with the other children or do dinner. She's hurriedly trying to cook that dinner, and she's also multitasking, trying to help her elementary age children with their homework. I don't know if anybody can relate so far. She's also starting to get pretty frustrated and overwhelmed. She might start to yell at the baby because of his whiny needs. She doesn't realize maybe that he's still hungry and he's tired, and that he's reacting to the mother by losing what little control he has because he's not regulated. So he starts kicking and sobbing and clinging to her chest. She may now feel even more overwhelmed, frustrated, and guilty, and she may begin to lose patience with not only the toddler, but the older children as well. So in reaction to what this mother is feeling, the older children may start to act out because they're not getting the attention that they need. They may start making demands, shouting loudly about the older child crying, they can't do their work. They may get frustrated themselves and start crumbling up their own work. And this makes the mother even more frustrated because she might end up yelling at everybody, and she doesn't get dinner done, and she at least picks up the youngest one and walks out of the room. So this is oftentimes a scenario that we will get of a parent just getting pretty frustrated and pretty upset about what's going on. So what we can assess is that the child is upset. Mom's reacting to the child. This toddler's discomfort pulls her attention away from the other children. Older children respond as they probably should because they're probably getting pretty frustrated by themselves. They're not getting their homework done. They're hungry themselves, so dinner's not getting ready. And so end results is that no one is happy in that home. So regardless of the families, what we look at, we look at the situation, the circumstances, and what are their needs. How can we help them in this program? So I have these little nifty videos that I hope you guys will bear with me because they didn't quite get embedded in the PowerPoint the way I'd like, but Brooks is going to help me with those.
Sweetie, we're not getting a toy right now. Put that down, okay? Put that down. Let's get ready to go bye-bye. Do you need a toy, really? Put that down. I know, but Grandmama's going to get you a toy later. Let's put that down, okay? Oh, my goodness. Really? Let's put that down, now. Put that down, Lily. Come on, Lily. Let's go. Put that down. Put it down. Put it down. Put it down. We'll pick a toy from the front of the store. I know, but we'll get a toy from the front of the store. Look how big London's being. He's such a big boy. And what are you being? A baby. You don't want to be a baby? Well then put your shoes on and let's get ready. Let's go. We're gonna get a jack-o'-lantern. Okay, we'll get a toy later, but not right now. Get off the floor, London. Come on, let's go get on the basket. Well, maybe somebody else can get you a toy, but Grandma's going to bring you a toy, sweetie. But Daddy's not getting you a toy right now. We've got tons of toys at the house. You're going to get a toy for Christmas.
I want a toy.
Oh, okay.
So what do you think about that? You see that pretty much when you go to the grocery stores or to the department stores? I'm kind of creepy sometimes because sometimes I'll see families walking around like this and I'll follow them. Because I actually want to see, is that dad or is that parent actually going to buy them that toy? And 9 times out of 10, they end up at the end getting the toy. Have you noticed that? Yeah. You notice also how many commands he gave her. And when he did give a compliment to the little boy, it was in competition to the little girl. So he's having a pretty rough time there. So what we want to do is we want to take these two scenarios and we want to look at how can we help parents to move past these kind of situations, to be able to go to the department stores or grocery stores and not have to deal with ordeals like this. And so it's almost like a parent's second hope. And a lot of times parents will say, I should have had this when I walked out of the hospital with the baby. Or somebody should have shown me this a long time ago. Because they're pretty frustrated and upset by the time they will come to us. And sometimes it's resulted in physical abuse that they've gotten so upset. So the beginning of this is that this is a program that came about in the 70s, and it was created by Dr. Sheila Eichberg, and she was at the Oregon Health Sciences University back then, but nowadays she's in Gainesville, Florida, and she's retired, and she has done a lot of research, and there have been a lot of branches that have spread out from the research that she did many, many years ago. So we have PCIT both nationally and internationally now, and people are using it to effectively help families. She developed the PCIT training manual that we do our trainings from. She developed the Guided Parent-Child Interaction Coding System, which is a DPEX where we code parents' language. And she incorporated parenting styles of look at the parent who's authoritative, look at the parent who's authoritarian, and look at the parent who's permissive, and see if you can kind of squish the authoritarian and the permissive and help all families by the time they leave this program to be in the authoritative mode. So it is an intervention for children that are 2 to 7 years old with disruptive behaviors that include oppositional conduct disorders. And it's also for caregivers who are like the dad in that picture who are just having a really hard time with their children. What happens is that the therapist will coach this parent therapist will coach the parent while the parent is playing with the child. And we do that with a bug in the ear, and we do it with a one-way mirror with a video feed. And this can also be done in the home and is being done in the home over the state of Washington. And a lot of times folks are not using the regular equipment that's in the clinic, but they're still using the manual, and they're still doing the coding, and they're still helping these families to move forward. So we look for kids who have really disruptive behaviors like hitting, spitting, kicking, huge tantrums. And when I do intake, and I do my own intake, I usually ask certain questions. Tell me about your child. Tell me what the behaviors are. And I'm looking for certain things like he's hitting me, he's kicking me, he's fighting me, he's talking back to me. He won't listen. And so if I have a child who's kind of fitting that category and in the 2 to 7 year range, then I can pretty much say, let's talk about PCIT. So parent-child interaction therapy, a lot of people think it's a training, but it is a mental health treatment, and it works best when clinicians do have the background to understand the theory behind it. And so we really want to have people who are actually gaining knowledge around what makes this work, why does this work, what's the theory behind making it work. There are 2 components to the program, and talk to the parents about the child-directed interaction play, which is where we're trying to build a relationship, we're trying to help them to like their child, trying to teach them some language. And then once we master that, we want to move over to the parent-directed interaction play, and that's where we teach some discipline strategies to help them to be able to manage behaviors that come up. So we can take folks into the program, but we also need to be mindful of people who are not going to do well in the program. And active substance abuse, now that's been defined. We can't throw everybody out because they take a drink or something, or because they're, that they drink at home. But we can say that if you have something that's hindering you from being able to interact with your child, and it's alcohol or drugs or whatever, then we're not going to work with you in the program. Parents who are actively engaged in domestic violence, it doesn't mean that we're not going to work with them. It just means that we need to just assess the degree of what's going on and figure out if this is something that will work for them. In my experience with domestic violence, when I go in, I learn as much history as I can. I want to know everything that I can possibly know before I go into that home. And I want to position myself in that home in a way that I'm going to be able to get out of there if I need to. But one thing I do for parents that I know that they may have something going on is that I talk to them about how effective the program can be for them if they use it as a couple, if they complement each other, if they notice what the other person's doing, that this can help the relationship versus hindering. And for the few domestic violence families that I have worked with, I've had some pretty good results because I've turned it around and said, not only is this for your child, this is for you guys as well. Major depression disorder, we don't want to exclude somebody because they are depressed, but if they're so depressed that they cannot do this, then we want to look at other avenues first and make sure they get the treatment that they need. We cannot work with anybody who's mentally retarded or has developmental needs that are so severe that we cannot be able to get the skills over. And of course, psychotic behaviors are some other mental health illnesses, such as I always have a hard time working with borderlines because it's hard to do that, or a bipolar mom that I may ask her to do something and she's shot way up in the air and I can't pull her down. So I have to be careful and mindful. It's not that I'm going to say you can't be in this, but I'm going to assess very carefully how I can do this. Chaos in the family might mean that maybe they need FPS in there first. Maybe they need something else. Maybe they need housing. Maybe they need to go get TANF or something to get settled. We need to figure out what it is before we actually bring them in, because PCIT is not going to mean a thing if you don't have a roof over your head. Okay? So, we're going to code when we're in a DPICS and we're observing the family. We're going to code for 5 minutes. We're going to be very silent, and we are going to code the verbal language that we hear, like that video that you just watched. If I were coding that, I would hear command, 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 all the way through. I'm also coding for body language. Do I see any high fives or, or pats on the back or anything that's warm and friendly towards that child? And I'm going to observe the parent's response to the child's needs. If a child asks for something, how attentive are they? Children who have to go to the bathroom, how attentive are they around being able to take care of those needs? Okay. So I thought I'd give you a little bit of an example of what a coding video looked like.
Eyes are different.
Yeah.
One sticks out and one doesn't.
I'll trade the eyes for because that one is the same as that one.
You're right, those are the same.
Trade them.
Oh, that was a good idea to train them out so they have matching eyes. And then
The one's up and
that's
you put right.
And now put this eye on that creature.
Yeah. Right. And he's still changed.
He does still look strange. Thanks for putting that eye right there. That was a good job of doing that.
His eye, he can twist his eyes. He's a talented muncher. He can twist his
He
eyes.
can twist his eyes. I bet you he can look all around.
Yep, he go.
I wonder if he can look behind him.
Lots of animals could do that. Real animals, though, not these kind of animals.
You're right, you're
But
right.
real animals.
You're right, real animals can do that. What do you want to play with next?
The boom.
The booms, the booms, the booms. Let's put these away so we have enough room. Oh, thank you for helping clean up. Is it okay if we take these apart?
Yeah. I don't really care. I just like the tower. That's why I wanted to keep
Yeah, the tower is cool.
Oh.
Hand me one of those other ones so we can.
Okay, I'll hand you one of yours so you can just. Here.
Thank you for handing it to me. It started falling apart already on its own.
That could be his hat. He has a Santa hat.
Yeah.
No, he has flowers growing out of his head.
Oh, flowers. I wonder if they need to be watered.
Ah, flowers are pretty.
They might get wet if they water the flowers though.
Yeah, he may get wet. Hey, why are you watering me? I don't need to be watered. I just need my
And I would
flowers.
be coding every letter that come out of
This is my
his mouth.
flowers. Oh, there's one.
And I would be listening for the praises
Thank
that she's
you. That's
giving.
Heidi.
I would be listening for
I
her
saw
behavioral
him.
descriptions around it. I would be looking to see how she's interacting with this child.
Okay, I have no idea how I'm going to make a creature, but if I make a good one.
Should we dump them out so we can see all the pieces?
Yeah, but what is this doing?
That doesn't go in there.
I know.
And,
Let me put it on.
okay, that's a good idea to put it right there. Let's see. The bones.
All of them.
All of the bones. Alright, so that's a good idea to take them apart
Yeah,
so we
see?
know. Yeah, so we know what we have. Some of these are hard.
Yeah.
You must be really strong to be able to take all these
Hey,
apart.
I'm going to use these. I'm going to make a little platypus. I like platypuses. I'm going to make.
Platypuses. I like platypuses too.
Or am I saying it right? Platypuses, or is it a platypus?
Platypus. I think platypus.
Yeah.
I've never
Look,
seen
if
these.
you walk, don't.
Oh, that's right. Here's another one that's like that. And we can. Oops. Uh-oh. Let's see. Can you find another foot?
No, I can't. So that's why I'm saying, oh, here's one.
Oh, you found another foot.
But there's no hole.
So what if we put it on this one?
Okay, that could work. You
Put
could.
that one on there, and we'll figure out how to attach them later.
Okay, no. Or
Here, put that foot right there, and then we can have 2 feet.
I know.
Thank you for putting that foot
While
on.
you're like doing it, while you're doing it, you could attach the stuff to there, and then they would both have 2 feet, but the body would be
Both have
attached.
2 feet. That's right.
Yeah. Thank you.
You're welcome. You were such a nice manner saying thank you.
What'd you notice in there? Any comment? A lot of praise?
I'm going to ask you guys to speak into the microphone so we can get it recorded if you have some response. So, any other comments?
Okay. So, you probably didn't have a lot of comments because you don't know the language yourself yet, right? You don't know what you're supposed to be looking for. So, let's talk about what it is. So, PCIT, I told you it was 2 components, and the first we're going to talk about is the child-directed interaction play. And that's where we just want to enhance that parent's relationship with that child. We want that parent to get in there and feel comfortable talking to their child and just being around their child. Because a lot of parents say, I love my child, or I like my child, but I don't want to be in the same room with them. So we want them to kind of get that feel for, it's okay, you can do this. So what it does is that it teaches parents to attend to appropriate child behaviors. It's going to help them to be consistent with those with their language with the child. And it's going to teach that child that there is predictability from that parent. Because we have the parents who one day they're this way and the next way they're that way. And so we want to teach that parent and that child that you can be consistent and you can be predictable. Once we have gone through the relationship piece of this, and parents have to reach mastery in order to move or graduate from one component to the next, then we want to introduce them to what's called parent-directed interaction therapy. And that is where parents who've been yelling at their children or screaming or bribing, as you saw in the first video, that we're going to teach them how to give their child a command and to do it safely. We're going to teach them how to keep their voice nice and neutral and give the command and follow through on whatever it is that they need. Both of these components, they're research-based, and so they're going to be assessment-driven. We're going to be looking at them in the beginning, we're going to be looking at the middle, and then we're going to be looking at them in post. So we do that through standardized measures. I mentioned earlier that Dr. Eichberg created the ECB, and that's what we use. We also use the parenting stress inventory to kind of figure out how stressed out is this parent, not only parenting this child, but overall the things that are going on in this parent's life. So the process of treatment from beginning to end is going to include the intake assessment, it's going to include the teaching session, the coaching, and the mastery of PCIT in both components. And stop me because I know, that when I first heard this program, I had no idea what the instructor was talking about. So feel free to ask me questions as I go along. So the overall goal is that we want to improve the lives of the children and their families. We want to help them to be able to function in a way that's going to be quote unquote normal for them. So it's going to be a treatment that hopefully is going to engage and motivate them to want to change a negative situation into a positive situation, such as the mom who came home from work and she's got the toddler, or the dad who's at Walmart. How can we help him to have a better life with this child? So PCIT is different from regular parenting classes, and I know a lot of people, they go to parenting classes, they sit in a room like this, they have a notebook, they take notes, and an instructor may say, take these notes and go home and try them on your child. And it's not to say that that won't work, but having them in the session together and you're dealing with the behaviors in the moment has been proven effective. So what we want to focus on in this program is that we're going to put the parent and child in the same room together, and we're going to be behind that one-way mirror. The parent's going to have the bug in the ear, and we're going to be talking to them about the behaviors that we see in the moment. So that in itself hopefully is going to help the parent-child relationship. So the parent is going to be coached to use strategies that are actually going to hopefully decrease the behaviors in the moment. And in the moment just means that, they're practicing now, but these are real life. We want to take them out to the real world so that they can generalize these skills. So when we do this, it's going to help children to feel safer. They're no longer going to be afraid of their parents, hopefully. It's going to help that parent to enjoy being with the child. I can be in the same room with you now. It's going to teach that parent how to communicate, how to use language to redirect something. A lot of times situations occur because parents go in a direction that brings out the negativity in the child. It's going to improve not only that child's self-esteem, but that parent's self-esteem. We very seldom in this program go into the schools. What we do is that we bring them into the office or we go into the homes and we work with them very carefully around how to interact with your child. Child starts feeling better because he's getting more positive attention from the parent, and then he starts reacting a little bit better in the school or in other settings. We have parents will come in and say, I cannot get anybody to babysit my child, or I can't take my child to anybody's house. We've been banned from friends' houses because the child is out of control. And when we do this, we can start removing some of those barriers and helping them to have a normal life. What ultimately will happen, or what we want to happen, is that we want this to secure the placement. We don't want the child in foster care. If they are in foster care, then we want to help them secure that placement there. We want to help that child and parent or caregiver to feel more comfortable in what they're doing. So the parent is coached to follow the child's lead. That is the number one rule in the relationship component, is follow the child's lead. And the parent in the video, the last video, she was leading a little bit. Might have been her very first session. But what we want to do is teach her that she's not to suggest things. She's not to prod the child on in a different direction. It's the child's play. And so her role is to follow that child's lead and play with the toys according to the way that the child wants to play with them. So we want that parent to respond to the child in actions and words and say things like, I like how you built the tower. Thank you so much for sharing your toys with me. Great idea putting glasses on. All in response to the child's play. It's never me saying, why don't you do this or you should do that. It's always observing and looking at what the child is doing. The expectation for this parent is that they're going to be consistent and predictable in attending the sessions weekly, bringing that child when it's necessary, doing their homework. And homework is a stickler. Anybody who knows me knows that I will get the homework. Because if you're not doing the homework, there is no reason to come and see me every single week. And we can't help each other. It's also a stickler for me that you practice. Not only that you practice intensely for 5 minutes a day, that you use this language throughout the day. That you find an avenue there somewhere where you're like a detective around your house. And this is how I explain it to parents. You're walking around trying to catch your child being good. And I want you to kind of close your eyes on the things that you think are not so good and kind of ignore those things, but really, really focus on things that are going well. So this is kind of what our room looks like. And we do this on purpose. We have a bare room. And even if you go into the home, we want to find a room in the home that has the least amount of clutter or anything else in it. And in the office, we have more control, of course, because I can determine I only want a table and chair in there. I only want toys on the table. But when I go into homes, it's a different story. And so I have to be careful about trying to find a place in the home, ever how small, that we can do this without getting outside interference. If I'm in the home, I have to make sure that relatives aren't there. I have to make sure neighbors aren't knocking the door, the cell phone's not going off. Just little things that might be distracting. If I'm in the clinic, I pay attention to such things as if the parent has gum in their purse, if they're drinking coffee, if they're drinking water, anything that can distract that child away. And I have often taken parents' purses and said, I'll lock it up in the other room. Come and go with me and I'll show you where I'm going to put your purse. Because I don't want anything to interfere with their interaction together. So what we have here is a typical PCIT room, parent and child, one-way mirror, table, couple of toys, and this particular room, they have some little things on the wall. It's fine, but in my office, it's totally bare. It's kind of pretty. Maybe I should do that. When we teach parents how to do this, we're going very slow. We take 90 minutes out of a parent's day and say, I want you to come alone. If they bring the child with them, we're not going to get the teaching session done because they're attending to the child, right? To 7 years old. And so the appointment is with that parent only. And we use the manual to sit down with them and go over a teaching session. In the teaching session, we're doing what's called tell, show, do, and review. And we're doing a lot of role plays in that teaching session. In that teaching session, we're teaching them 5 very powerful words. And those words are praise, reflection, imitation, description, and enjoy. And I don't take it for granted that anybody knows how to do that, because if you notice in the Walmart situation, he didn't know how to do it. If you notice in the coding situation, she was doing some of it, but not a lot. So I want to teach parents, how do you do this? And how do you do it with a good affect? Okay? Because that's important that you know how to deliver this. So when we do the do skills, we want to increase the prize skills: praise, reflect, imitate, describe, and being able to enjoy. And if I were to walk out in the waiting room and a parent's having a hard time with their child, I may say something to them like, now might be a good time to use a pride skill. So no one around me will know what we're talking about unless there's another PCIT there. But she's able, if I say that to her, she's able to pull out any one of those acronyms and use them to her best interest. So if she chooses to use praise, she's going to praise the behavior that she sees in front of her. A praise could be, I like the way that you are sitting on the couch with me. Good job staying right beside me. If she's reflecting and the child says, Mommy, look, you want me to look. Or if the child says, the wall is blue, blue. Lots of times when children are talking to parents, what we want to teach them is that they only want the attention. And so if a child is tugging on you, it's because I want you to listen to me. I want your attention right now. If they just will look down, give them the attention, and go ahead and do whatever else they're doing, the child usually is satisfied. I want to teach them how to imitate a child's play. Now, imitating, I learned a long time ago that not everyone knows how to imitate. I have sat with parents as to where the child is drawing one thing over here, and the parent is drawing the same thing, but they're drawing it totally different over here. And so what we're doing, if you look at that, you're setting up competition. Because the child puts the chimney on the side of their house, but the parent puts theirs on the top. And all of a sudden, and they draw a mansion. And the child looks over and says, I don't want to play with you anymore. You're just better than mine. And so we teach parents, if the child puts the chimney on the side of their picture, you look at their picture and you do the exact same thing and you put it on the chimney on the side of your house. Because, and I remind them, when you were 2, 3, 4, you didn't know how to draw either, right? And so what you're doing is that you're coming down into their world and you're doing things the way that they do them, because when they get to be your age, they are not going to put the chimney on the side of the house. All right? So in doing that, we want them to be able to connect with their children. The other thing that we want to do is teach them how to describe behaviors. Describing behaviors is talking about what you see in the moment. Imagine that you're sitting here and you're using your muscles. You're holding your hands together. You're putting your arms on your chest. It's what you're doing with your body. You're picking up the pen. You're putting the pen down. You picked up the blue toy. You put the blue toy in the container. And sometimes people think, well, that sounds really silly to do. And a lot of parents will say, that's so phony. But maybe it is. But you're getting down into your child's world. And so it's your child that you're trying to relate to. It's your child that you're trying to connect to. And when you do that, they're like, wow, she's actually paying attention to what I'm doing. She's listening. And maybe, this is the first time parents will tell me, they're just doing this. They don't act this way at home. Well, maybe for the first time in their lives, they have your undivided attention. And so they are responding to that. And that's work that I do with the parents, let them know that I don't think that they're putting on a show for me. I think they're enjoying what they're getting from you. And let's do some more of it. The last thing we want to do is to teach them just enjoy, have some fun. I mean, I'm in the back. I've got the microphone and I'm talking. I'm the one who's playing with that child because my voice is throwing and I'm excited and I'm having a good time and I'm teaching them how I want them to talk. And it's almost as though I'm in the room with them. And I always say, if I'm not having a good time, I just need to call it quits. Because I absolutely adore, playing with these children and watching their parents play with them as well. The thing about that is that when I train, I tell folks, though, you're in the background. You need to stay in the background. If you yourself want to put yourself in that room or in that position where you are the one who's, doing these skills, then you may have a problem. Because it's not about you. It's not about you as a therapist. It's about what you can deliver to that parent to help them to have a better relationship with that child. And so I always assess when I'm training, is this something that you really want to do? Can you do this? Can you put yourself in the background? You'll still have fun, but you're just not there making that warm, cozy relationship. Now, we do all these nifty positive things, and then we want to be able to teach parents that it's not always going to be good. It's not always going to be something that you can, be joyful around. At times, as you're giving attention, you're going to have to take away attention. And so when we do that, we want to teach them how to use selective ignores, know when to ignore. Like the little girl at Walmart in the video, she might have had a different outcome if that dad had ignored a lot of that behavior instead of responding to it. If he had walked away, if he had put her in the cart, or if he had reversed that and put all of his attention on the little boy, that might have helped her out as well. So when we give things, it's just like in kindergarten. You give something, you got to, you take away something. You take away something, you got to give something. So this is our takeaway. We want to take away the skills that will bring out the negativity in a child. So a lot of times that's commands. What they do is that they lead the behavior, they lead the play, and you risk negative interactions. Little children aren't born in the world to say no, but by the time they're 2, they know that word very well. And so we want to teach parents to avoid those things if possible. We want to teach parents how to avoid questions. If it's a necessary question, ask it. But if it's not, if I'm tired and I want to go home and I'm sitting on the couch and my child's there and I say, bring me a drink of water, is that necessary? Or is that something I could do myself? So I want to teach them how to, if you're going to ask a question, make sure that question is a necessary question. What we found is that questions will often hide commands, like indirect commands hide questions. It takes that lead away. It's like you ask a child, what did you do? Or who took the last cookie? I hate it when a parent does that, because if you're the only child and you say, who took the cookie? Well, who took the cookie? That's a setup, right? And so I want to help them to be able to get away from the questions unless they're absolutely necessary. These questions, too, when you ask a child a question, if you notice, you will ask the question, the child will give you a very blank stare. And what we want to do in PCIT is little 3- and 4-year-olds should not have that pressure on them to figure out what's the best answer that I can give you that will keep me from getting knocked against the wall or getting thrown into my room. So a lot of families that come to me, they are coming to me because there's been some kind of physical abuse or some kind of hostile parenting that has occurred. So I want to help these children just to relax and just to be children and not have to worry about getting into trouble. So not getting rid of the questions altogether, but cutting them way, way back. Absolutely, I'm very picky about the criticism. Criticism, I tell parents, is something that's very subtle. You don't really realize that you're doing it, but if you're a little kid and you're learning the language and you're moving into the world, you're picking up on everything. Your errors are out. But it's very subtle, even in play. Child can be building something and a parent can say, well, why didn't you put it over there? Criticism. You should have put it this way. Criticism. And then the child pretty much at some point would say, I don't want to play with you anymore, because they're picking up on that. Or they will start to criticize and use the language that you use, so the siblings are back to the parent, and parents don't like that either. One of my favorites is I tell parents, do not ask a little one if you are fat or if this dress looks well, because they will tell you the truth, okay? You don't, and what happens is that it's a criticism that you're putting on yourself. And you're asking them a question and they're going to throw it back to you in a critical nature, and you're not going to like it, okay? Any questions so far? Okay. So when we tell, we explain in detail the skill to be taught, and that is label praise. Label praise is a statement that praises a child's behavior in the moment. Not yesterday, not last week, but in the moment. If you want something to change, praise the behavior. If you ever notice when it's cleanup time and you start telling children to clean up and you start praising them, the more you praise, the faster their hands will move. And that's what we want parents to do. It's going to let that child know that you actually like what they're doing when they do it. And it's going to, again, increase that child's self-esteem because you approve of them. The other thing, too, is that in PCIT, there is a lot of role play. So we always want to demonstrate the skill with the toys. We want to take the teaching session and actually role play with the parent exactly what it is that we want them to do in 5 minutes at home. So we want to tell them when you describe, give them an example, have them to give you an example back, have them to play, and we want to make sure that before they walk out the door, they have a clear understanding of what a description is. So I may say to that parent, I may be building something with the toys, or I may be drawing something, and I'll say, you're drawing a boy with a smiley face on your paper. What I'm doing is I'm letting that parent know the child is the focus. It's you. It's not we, it's you. And I'm talking about what the child is doing in the moment. You're drawing a hat on the boy's head. And if you visualize a child sitting there drawing and you just play by play, I always related that it's like the sports. The person who is narrating and I'm not a sports person, so forgive me if I don't get the words right, but the person who is narrating, he's just play by play. He's not interjecting anything in there other than what he's seeing in front of him. And that's what we want parents to do. Imitating, I think we talked about that a little bit earlier, that if they're drawing a picture, you want to make sure that they draw the chimney on the side of the house exactly as the child is doing. And I don't just take it for granted that they know how to do it. I have them to draw something, I'm drawing something, and we role play it out. So let's take a little review here. That I'm going to make sure that in 90 minutes before that parent leaves the office that they can, give me an example of each one of these and how they're going to implement it to the child, because I'm going to give them a homework sheet at the end of that 90 minutes of teach session. I'm going to ask them to go home and start the play. So I want to summarize with them. Tell me how you would praise a child's actions. Tell me how you would describe. Tell me how you would imitate that child's. I want to go down the list and make sure they understand it before they leave the office. So once we finish that teaching session, then we want to look at some coaching. We want to figure out, how we can use our own assessment of what we have learned in the DPEX and the intake and the teach session to help that parent to start using these skills in a coaching session. So.
I really like your cat, Hannah.
Trying to look nice. So I was gonna get this picture.
Oh, you were gonna give that picture to me. Thank you so much for drawing a picture for me. And now you're drawing a smiley face picture.
See.
I'm looking for a dark color marker. Please hand me the teal marker.
It was kind of lightest too.
Thank you for
It's
handing me the
pretty,
marker
too.
when I asked.
Looks pretty too.
Thank you for showing me how it looks pretty. I think I'm going to draw a butterfly. You're looking at my butterfly. Looks good. Thanks. I really love your cat.
I'm just trying to. I was gonna color this over red after I was done.
You were going to color that over red.
So it'll look like a different color.
I need some different colors for my butterfly. Could you hand me one of the purple ones? Thank you so much for doing that.
If it doesn't work, I was gonna get this one.
Oh, so you were picking both the light and the dark color purple. That was very smart to know that those were both purple, Hannah. You know your colors. You're welcome. I like it so much when you use your manners.
Send this over here in case if you want to do some dots.
Oh, thank you very much for that.
If you want to do some dots,
If I want to do some dots.
and if you don't want to do them red, just
We can do some red dots.
in there or something. You can use that for some sprites if you want. Stripes if you want to.
Oh, stripes.
I keep on doing this with stripes.
No, it's okay.
Are you starting to hear the reflections,
Huh.
the phrases?
I've got some that wing too. Yeah, please hand me that light purple again. Thank you so much for listening.
I think I got the videos mixed up. This is my PDI video,
If
but
you need the orange one,
you know, we're gonna
if you
watch
want
it,
some
right?
stripes.
Oh, thanks. My butterfly has stripes and dots.
Well, that's a very unique butterfly if it doesn't have the same patterns on each wing.
It is a very unique butterfly that doesn't have the same patterns. Well, I'm all done coloring, so please help me clean up. Hannah, if you don't help me clean up the markers, you're going to have to go to the timeout chair. Hannah, please stay here until I tell you to get up. Hannah, are you ready to come back and help me clean up the markers?
Yeah.
Hannah, please put the paper back on the clipboard. Thank you so much for listening the first time.
Okay, let's take this green out and just put the paints with paints. So we go, whoops, there's your green.
You're doing a great job putting the paper back on the clipboard.
So just keep that video in mind when we get to the second component. Sorry about that. So there are 5 little words that we discourage parents from using. And that is no, don't, stop, quit, and not. So if you have children yourself, you can think of how many times that you might actually say those things to your own children, or how many times you hear your parents say those things, and then notice the reaction that comes after one of those words are stated. No, what do you hear? Tantrums. There you go, telling me what I can't do again. And so children react to those things. So we want to cut those words out unless it's danger. If it is danger, of course we want you to say stop. Of course we want you to say quit or not to do something. But otherwise, if you're just at home and you're relaxed and you're interacting with your child, figure out if you can avoid those words. And during 5 minutes of coding, what we're doing is that we're looking to figure out, can we hear what we call in the coding system 10-10-10. We want to be, my ears are keen to listening to 10 behavioral descriptions, 10 reflections, and 10 praises. You probably heard quite a few in this last video because she has passed the mastery of this, and so that was actually a PDI video, but she did very well in giving praises, reflections, and behavioral descriptions. The goal, again, is to make sure that you continue to decrease those questions, commands, or negative talks. And you don't want any more than 3 combined. So by the time that in 5 minutes, you should not hear any more than 3. And I usually get it down to 0 because I don't want to hear them at all. So again, it's assessment driven. So maybe we're thinking about this family has reached their mastery and we're going to do a mid-treatment. Mid-treatment, we're going to administer the standardized measures again. And we're going to look to see what the behaviors are. Have they improved? We're going to see how confident that parent is in managing behaviors. And usually around the 3rd or 4th session, PCIT, CDI goes to about 5 sessions normally. Around the 3rd session, if I've had a child who came into the office, jumping on furniture, yelling and screaming, running up and down the hallways, by the 3rd session, and no more than the 4th, you should walk out in the waiting room and you're looking for that family. They are so quiet until you don't even realize that they're even in the building because the skills are taking effect. And if they're not, then I always ask the coach, reassess yourself to see if you've, covered all of the bases. This is what a PCIT room may look like. And you can have a second parent in the room. So there's mother and child. There's the coach with the plugging the ears on. And then there is probably a second parent in this room because we want that other parent to be able to observe and review what's going on. And by this time, they can look at each other and observe. So that PDIT session, we're going to again do 90 minutes with that parent because we want to teach them the skills of what it is that we want them to do in the second component. So I know this is a lot, but this is what we're going over in 90 minutes. The video didn't go through all of the steps because I think it was just a training video, but let's look at it. I'm going to teach that parent, again I'm role playing, how to get a direct command from that child. I'm going to say, please hand me a red block, and I'm role playing with the parent. And I'm going to say, if they wait for 5 seconds or whatever, that's fine. I'll give them that. But after 5 seconds, if I don't get it, I'm going to say, if you don't give me the red block, you will go to timeout. Or you didn't give me the red block, now you will have to go to timeout. Okay? So I want to give that child a chance to process what it is that I've said and to be able to listen and comply with the command. So the child doesn't do it after I've given them the second warning. I would say something to them like, you didn't do what I told you to do, now you're going to go to timeout. And as I'm saying that, I'm going to stand up and I'm going to be walking. We use a bear. I'm going to be walking that bear over to the timeout chair. And I'm going to say to that bear, please stay on the chair until I say that you can get off. Now this is when parents, they run into a little bit of trouble and they say timeouts don't work because they'll say something like, okay, you didn't give it to me, go to timeout. And they're pointing to it and they expect the children to go. And then they don't tell the child to stay there. And so children are standing at the door or whatever after about a minute saying, is it time? Can I come out? I won't do it again. So that's putting that child in control of this, and we want to take that control away from the child. So teaching that parent to say, stay in this chair until I say that you can get off, or stay in your room if that's the timeout until I come and get you. Once they've done that, then we tell the parents that it's 3 minutes that they need to stay in the chair. The chair is plan A. Parents will say, well, why can't I just send them to the room? Because then you've cut out your plans. So start off with the chair first, 3 minutes in the chair, and they have to be quiet for 5 seconds before they can actually get out of that chair. So I could be kicking and yelling and screaming for 3 minutes, but before I can get out of that chair, I need to be quiet. Okay? So once they're quiet, you're sitting quietly in the chair, are you ready to come back and hand me the red block? If they say no, you stay another 3 minutes. If they say yes, you take them by the hand and you bring them back. And the first thing that they will have to do when they get back is, you guys know, give me the red block. Okay? So this is the follow through. You notice in the store when the dad was saying, put it back, put it back, put it back, put it back, there was no follow through. He didn't have any plans whatsoever of how he was going to get that child to put that toy back. So this is, even when we take parents to the grocery store, and I do field trips, if I take them to the grocery store, I usually want to go down the candy aisle or the toy aisle, and I want to see how well they can put into play the skills that they have learned over the course of working with me. So if they can go down the candy aisle and the toy aisle, they can get through it, then I know that they've learned the skills. If they're still saying, put that back, don't touch that, leave that alone, then we haven't done very much work. We need to go back to the drawing board.
When you're in a public place like that, you don't do a timeout. What do you do?
Oh,
You leave
yeah.
the store? Do a timeout in the aisle? Oh, I'm sorry. Usually I don't need this. You do a timeout in the aisle in a public place?
We teach them how to take their child to the store. We have them to figure out before you even leave your home, how do you want this day to go?
Yeah.
Okay? You're play by play. You're going to hold my hand. You're going to get in your car seat. You're going to wait for me to come around and unlock your car seat. Then you're going to hold my hand. It's just play by play by play. Decide before you go into the store if you're going to put them in the basket or if they're going to walk with you. Decide if you're going to give them a treat before you even walk in the store. You plan ahead every step. You stay one step ahead of your child. You give them a job to do. This is the key to, I think a lot of times parents miss, is that the child is on their agenda. And so they're dragging the child to the store and the child is miserable.
Right.
And so the child acts out. And so what we want them to do is give that child a job to do. And it could be the grocery list, putting something in the cart, taking something off the shelf, but they're active, they're busy in that session. And when I take parents on field trips like that, they will say to me that that is the best trip, or the best time they have ever had with their child. And they want me to go with them every time they go to the grocery store. But of course, I'm not going to go do that. But it's teaching them that you can do this, but you have to be attentive.
What's funny is what you mentioned is exactly what we do when we work with parents of kids who have been drug exposed who are symptomatic, because we call it giving them all the information all the time, because their anxiety level often, if they're symptomatic, is right on the surface. So we're going to go here, and this is what we're going to do. So it's great to hear that spelled out like that. And that other, yeah.
I know we're almost out of time, but if they can do this, then they will most likely graduate from the program, because we've gone probably 14 or more weeks by this time.
So talk to me about the backup plan if they don't comply with the timeout chair or sitting in the aisle or whatever, if they're raising up. What's that all about, the lifetime warning stuff?
Lifetime warning is about the chair. So if you don't do this, lifetime warning. Lifetime warning is if you get out of the chair again, you're going to go to timeout. That's one warning that you get. After that, if you get out of the chair, it's automatically that you're going to go to the timeout room. We don't give them that line again. That's what that means. The plan A and plan B are that plan A is that we ask them to take, they can go to the dollar store, they can get a placemat or, a cloth or something. They can take that to the store with them. And I also like the big squares in the store, that they can pick out one of those, the placemat or whatever, or they can use the square. Child acts out in the store or doesn't listen, they go directly through the sequence to the timeout. They stay there for 3 minutes. And we don't ever tell the child how long it's going to be because we don't want that is a time yet. So they stay there for 3 minutes, but they must stay there quietly to be able to get out of the timeout. So they need 5 seconds of quiet before they can actually get out. If they get out before they're supposed to, or they walk away or run away, you got off the square before I said you could, now you're going to go to timeout. Now I'm telling you, okay? And they go into the timeout, and the timeout could be that we go to the car if we're on an outing. And if the car is not working and they're throwing a huge tantrum there, then it might be that the whole trip, the consequence is that we no longer shop, we go home. But if they're in my office, what's going to happen is that they will go to a timeout room. Now, I know a lot of people say, you can't put children in timeout rooms, or people will say that's not okay, but the research says that it does work and it's fine to do that. The thing about it is that we can't leave them in there, and we can't leave them without the parent being in ear range of them. So we leave them in a room by themselves for 1 minute. Parent can be at the door or at the one-way mirror checking out and seeing what's going on. Again, they need to be there for 5 seconds of quiet before they can get out of the timeout room. And most children don't like either the chair or the timeout room, so they listen and they do what they're supposed to do. And then the key to this is that we can do it in the office all we want, but if the parent's not taking it home with them, then it's not doing them much good. And so we want them to be able to practice when they get home and follow through on everything that we've gone through in the clinic. Okay? Any other questions?
Can you tell me a couple of your secrets on getting parents to practice?
I don't know if it's how I look or what, but I'm not very friendly when I'm talking about homework. It's a very matter of fact and this is expected kind of a thing. And if they do not do the homework at home, again, that matter of fact face comes out and says, well, that's okay, you didn't do it at home. I have a spare sheet. Why don't you do it here? I'll wait for you. Or I left it in the car. That's okay, I got time. Just go get it. I left it at home on the counter. Well, I know they work in an office. Can you fax that to me? Or they live down the street. Do you mind running that by here before the next appointment? It's like I'm not letting them off the hook. And I say to them, you're going to get tired of me asking for this, so you might as well just do it. And usually they will do it. And if I forget to do a homework sheet, a lot of times they will scribble it out on line paper because they know I'm going to ask for it. And it's a disservice to them not to, have them do the homework. Okay? I'd like to run really quick. I know we're out of time, but I'd like to run really quickly. This is a bear. That's the way our bear looks. And I won't show the other video because it's just coaching. But I wanted to go back to that scenario that we talked about, that same situation where this child is whining and crying. This time, this mother, after going through the PCIT program for like 14, 15, 20 weeks, she knows now that she can regulate her own emotions. She can take a deep breath. And that's one of the things that we do in PCIT is we teach them how to breathe. We teach them how to relax. So she can collect her thoughts because she's in control. I always say to them, I'm not here to tell you how to run your family. I'm here to enhance what you already know how to do. And so collect your thoughts, you're in control, and realize, this time around she realized that the child is hungry. The child needs some attention from me. And she knows that because we have been practicing. She knows how to be soothing to her parent, like gently rubbing his back or offering him a snack this time, or this time she's going to place him in the chair and he's going to stay because he's got some food to help him stay there. And all the while she's doing that, she's going to be using the PCIT language. She's going to be walking him step by step. Looks like you're hungry. I'm going to give you an apple. Ooh, the apple looks so good. You're being so patient. She's walking him through it. She's keeping him occupied. The needs are met. That situation was de-escalated from the very beginning. And she remained in control the whole time through. And so this time around, everybody had dinner. Everybody's happy. And she's not going to have this huge escalation that you had. Now, sometimes people will say to me, why does this work? And my first answer, you can imagine what that is that it's magic. I don't know how it works. It just does work. But I do know how it works because we know that the research has guided us in being able to have a program that can help us to figure out how to use it on families to make their lives better. And so we do that through teaching. We do it through hands-on application. We do it through role modeling, through coaching. We do it through modeling ourselves. I always say that the time a parent walks in the door or when I pick up the phone, I'm in PCIT mode. I'm thanking them for calling me. I'm thanking them for coming across town. I'm role modeling the language to them from the moment I say hello until I say you've graduated, and we're all done. Okay?